Have you ever considered that the way you sleep might actually be putting your brain at risk every single night? This is not an exaggeration. Recent research shows that certain sleeping positions, which seem harmless, can reduce blood circulation, increase pressure inside the vessels, and even limit oxygen supply to the brain. Over time, this combination can significantly raise the risk of stroke, especially after the age of 60. And the scariest part is that most people have no idea. Sleeping feels natural, automatic. Nobody imagines that something as simple as the way you lie down at night could silently be harming your health. But the good news is that there are simple adjustments that can protect your health, improve your sleep quality, and even boost your energy during the day. In today's video, I'll reveal the most dangerous sleeping positions and also the best alternatives to ensure safer, more restorative nights. Let's start with the first dangerous position, sleeping on your stomach. Many people think it feels comfortable, especially because it can reduce snoring, but this position can actually be a serious enemy to circulation and brain health. When you lie face down, the weight of your body presses against your chest and abdomen. This makes it harder for your lungs to fully expand, reduces oxygen levels in your blood, and forces your heart to work harder. At the same time, your neck is twisted to one side, which can compress important blood vessels and limit the flow of blood to the brain. Over time, this means more strain on your cardiovascular system, poorer sleep quality, and for people over 60, a higher risk of small vessel damage that can contribute to stroke. Science backs this up. Studies published in the Journal of Clinical Sleep Medicine found that sleeping on your stomach increases nighttime awakenings, reduces oxygenation, and can even trigger arrhythmias in older adults. And I've seen this in practice. One of my patients, Mr. Carlos, 68 years old, said he always woke up tired even after 8 hours of sleep. We discovered he had been sleeping on his stomach his entire life. Once he switched to a side position, within just a few weeks he reported deeper sleep, less fatigue, and even sharper memory. So if you're used to sleeping on your stomach, consider making a change. The initial discomfort of adjusting is worth it for the long-term benefits to your health and brain protection. Now let's talk about another habit that may look harmless but can carry serious risks: sleeping on your back without a pillow. Many people believe this position is good for the spine, but without proper support for the head and neck, it can actually become dangerous, especially for people over 60. When you lie on your back with no pillow, your neck tilts backward into hyperextension. This compresses the airways, makes breathing more difficult, and increases the chance of sleep apnea. It also encourages loud snoring and sudden drops in oxygen during the night. Here's the critical point. Lack of proper oxygenation doesn't just harm your sleep quality, it can also compromise your heart and brain health, raising the risk of stroke. Research published in the American Journal of Respiratory and Critical Care Medicine found that people who sleep on their backs without neck support have higher rates of apnea and micro-awakenings, subtle interruptions that over time accelerate vascular damage. I recall a patient, Mrs. Helena, 70 years old, who always slept on her back without a pillow because she thought it felt more natural. But she kept waking up at night feeling short of breath. When she switched to a firm, medium-height pillow, not only did she sleep better, but she also reported more energy and fewer headaches during the day. So if you often sleep on your back without a pillow, consider making a change. The ideal is to use a pillow that keeps your head aligned with your spine, allowing for free breathing and truly restorative sleep. Many people, especially on cold nights, have the habit of sleeping with a heavy blanket covering their head. It feels cozy, it gives a sense of safety, but this habit can actually be very harmful to your health. When you cover your head, you create a kind of closed microenvironment. The oxygen inside that space decreases, while the concentration of carbon dioxide increases. This means that for hours, your brain is receiving less fresh oxygen and is forced to function under poor ventilation. This silent process can lead to morning headaches, fatigue, memory lapses, and over time, extra strain on the circulatory system. For people over 60, this lack of proper oxygenation makes the risk of small brain lesions and even stroke significantly higher. Science confirms this. Research published in the European Respiratory Journal showed that sleeping in poorly ventilated conditions disrupts the entry into deep sleep, the stage where the body regenerates tissues, consolidates memory, and restores the immune system. Without this restorative phase, brain aging accelerates. And it doesn't stop there. Studies also show that higher carbon dioxide levels can alter heart rhythm, strain the lungs, and cause small nighttime awakenings that fragment your rest without you even realizing it. I remember a patient, Mr. Antonio, 74 years old. He said he could only sleep well with his head covered because it made him feel safe. But he started waking up with constant headaches, fatigue, and a strange mental fog in the mornings. When we suggested he change this habit, leaving his head uncovered and adding extra blankets only to his body, his symptoms disappeared within weeks. He reported more energy, mental clarity, and even a better mood.
So if you have the habit of sleeping with your head under the covers, it's time to change. Always keep your face uncovered. Make sure your bedroom is well ventilated and use comfortable bedding. If you feel cold, add an extra blanket for your body, but never cover your head. This simple adjustment ensures proper oxygenation, protects your brain, and helps you enjoy a truly restorative night of sleep. Sleeping in a recliner chair is a common habit, especially among seniors dealing with reflux, breathing difficulties, or those who simply doze off while watching TV. At first, it may seem comfortable and even harmless, but in reality, this position can have serious consequences for your health. When the body spends long hours in this posture, much of the weight shifts to the legs. This makes it harder for blood to return to the heart, which can cause swelling and increase the risk of deep vein thrombosis, a dangerous condition that can lead to embolism. On top of that, the neck often tilts forward or to the side, compressing airways and blood vessels, reducing oxygen supply to the brain. Research published in the Journal of Sleep Research confirms that sleeping in a reclined position fragments your sleep. You may drift off, but you don't reach the deep sleep stage, the stage where the body repairs tissues, strengthens memory, and balances hormones. The result? You wake up tired, struggle to focus, and face a higher risk of cardiovascular problems. Here's a curious fact. On long-haul flights, doctors always warn about the risk of deep vein thrombosis precisely because passengers spend so many hours seated in a reclined position with little movement. Now imagine repeating that same scenario night after night at home. One story that stands out to me is about Mr. Paulo, 73 years old. He said he could only sleep well in his recliner because it eased his reflux. But over time, he began experiencing leg numbness and constant mental fatigue. After evaluation, the recommendation was simple: slightly elevate the head of his bed. This small change gave him reflux relief without sacrificing deep sleep. Within weeks, he felt more energetic and even returned to his morning walks. So if you often sleep in a recliner, it's time to consider healthier alternatives. Adjusting your bed with pillows or wedges can provide the same reflux relief while protecting your circulation and your brain health. Small adjustments can make a big difference. Many people prefer sleeping on their side, hugging the pillow. But there's one silent mistake that can come at a very high cost: placing your arm under your head or pillow. It may feel comfortable, but the weight of your head and pillow compresses the nerves and blood vessels in the arm. The immediate result is numbness or tingling, something many people ignore. But in extreme cases, this lack of circulation can lead to serious complications. I will never forget the case of Mr. Joachim, 72 years old. He had slept like this for decades. One night he woke up with his arm completely numb and cold. At first he thought it would pass, but at the hospital he learned he almost lost his arm due to restricted blood flow. Emergency medical intervention was needed to prevent the problem from progressing into severe thrombosis. This example shows how something that seems so simple can actually become a real risk to your health. And science backs this up. Research published in the Journal of Neurology has shown that repeated compression of nerves and blood vessels during sleep is linked not only to chronic pain, but also to serious circulatory injuries in older adults. So if you enjoy sleeping on your side, adjust your position. Use a firm pillow to keep your head aligned with your spine and a smaller pillow to support your arm. This small adjustment can prevent pain, protect circulation, and safeguard your long-term health. Many people think it's normal to spend the whole night moving, constantly turning from one side to the other. But this habit can actually be a warning sign that something is not right in your body. Healthy sleep should follow well-defined stages, such as deep sleep and REM sleep, which are responsible for restoring the body, consolidating memory, and protecting the heart. When you keep changing positions throughout the night, even if you don't wake up completely, small changes occur. Your heart rate spikes, blood pressure rises, and brain oxygen levels drop for a moment. When this happens repeatedly, night after night, the risk of hypertension, memory loss, and even microvascular damage in the brain increases significantly. Studies published in Sleep Medicine Reviews found that adults over 60 who experience fragmented sleep, marked by frequent position changes and micro-awakenings, are up to twice as likely to develop early cognitive decline. And here's something important. The causes are often simple but make a big difference. A mattress that's too hard or too soft, the wrong pillow, chronic joint pain, accumulated stress, or even undiagnosed sleep apnea. So if you wake up tired despite sleeping many hours, or if you notice you toss and turn all night, don't ignore the signal. Continuous deep sleep is just as important as healthy eating or regular exercise. It's what protects your heart, strengthens your brain, and sustains vitality after 60. Now you understand why certain sleeping positions can be a silent but very real danger. What might feel like a comfortable way to rest can in reality increase the risk of high blood pressure, poor circulation, and even stroke during the night. And this is not an exaggeration. A few months ago, I met a 68-year-old gentleman who always slept in a position that pressed against the blood flow in his neck. He thought it was just a cozy way to sleep, but he began waking up with dizziness and numbness in his left arm.
After some tests, we discovered that his sleeping position was restricting circulation and leaving his brain vulnerable to microclots. Fortunately, he sought help in time and was able to adjust his sleep habits before something more serious happened. That's why I always say, never underestimate the power of a proper night's sleep. Every small adjustment you make, from choosing the right pillow to adopting the safest position, is a way to protect your brain and preserve your independence. And before we wrap up, I'd like to invite you to take the next important step. Right below this video, you'll find an exclusive ebook available for just a symbolic price that goes deeper into the topic of sleep and brain health. It's designed to complement what you learned here and help you put the right changes into practice. So, if this video brought you value, subscribe now to the Longevity channel. Hit the notification bell so you don't miss our upcoming content, and share this with someone you love. Because taking care of your sleep means taking care of your life, and your health deserves that.